We all think we know what a headache is, right? It's that nagging pain we just want to go away. But what if we've been looking at it all wrong? A headache isn't just random pain. It's a really complex signal from your body. And learning to decode that signal is so important. Because trust me, not all headaches are created equal. So let's just jump right in with a question that honestly gets to the heart of a huge medical myth. You know that pounding pressure you get behind your eyes? The one you always blame on allergies or your sinuses? Well, what if it has absolutely nothing to do with your sinuses at all? All right, to really get this, we need to meet the two main players in this whole story. Let's think of them like two different characters, each with their own unique personality and calling card. If you can learn to tell them apart, you are way ahead of the curve. So on one side, you've got the migraine. This isn't just a headache, it's a full-on event. We're talking pulsating, throbbing pain, usually camped out on just one side of your head. And it loves to bring its annoying friends along for the ride. Nausea, sensitivity to light, the whole crew. And then you have the tension-type headache. This is a totally different beast. It's that tight, squeezing pressure on both sides, like a band around your head, that classic vice-like grip. But here's the key. It usually shows up alone, without all those other nasty symptoms. But you want to know the absolute simplest way to tell them apart? I call it the activity test. Just look at this table. See that middle row? If you have a migraine, something as simple as walking up a flight of stairs can make that pounding pain so much worse. A tension headache, though? It couldn't care less. It's just going to sit there, that same dull pressure. That one difference is a massive clue. Okay, now we get to the main event. We are about to unmask the great imposter in the world of headaches. And I'm not kidding. This is a myth that's so pervasive it leads to countless wrong diagnoses and years of people getting the wrong treatment. So picture this. You feel that familiar, deep ache starting to build. It's right in your forehead, across your cheeks, exactly where your sinuses are. You can just feel that pressure. And then, more evidence starts piling up. Your nose gets stuffy. Maybe your eyes start watering. Every single sign seems to be pointing to one obvious culprit. It's gotta be a sinus headache, right? Case closed. I mean, with symptoms like these, what else could it even be? Well, get ready for this because the actual science is pretty stunning. In over 90% of cases, it's not a sinus headache. That's right. Study after study shows that the vast majority of people who are absolutely convinced they have a sinus headache are actually having a migraine. So why does this happen? Well, it all comes down to a major nerve in your face called the trigeminal nerve. When a migraine gets triggered, it can irritate this nerve, and guess what that does? It causes the exact same symptoms: nasal congestion, watery eyes, facial pressure. It's a migraine in a perfect disguise. Okay, we need to shift gears now, because we're going to talk about some of the less common, but way more severe types of headaches. For these, knowing the science isn't just helpful, it can be absolutely life-changing. First up, meet the cluster headache. The pain from this is on another level. In fact, it's been called one of the most painful conditions known to medicine. It is a strictly one-sided attack, usually feeling like it's drilling right behind one eye. And it brings very specific symptoms with it, like a tearing eye and a runny nose, but only on that same painful side. The attacks are short, but they come back again and again in these brutal cyclical patterns called clusters. Next is trigeminal neuralgia. Now, this isn't a headache in the way we usually think of it. It's a facial nerve pain condition. Its defining feature is the type of pain. People describe it as a sudden, stabbing, electric shock. It's often caused by a blood vessel just pressing on that trigeminal nerve, and it can be triggered by something as gentle as the wind on your face. Now for a true medical emergency, temporal arteritis. If someone over the age of 55 develops a brand new type of headache, especially if it comes with scalp tenderness, jaw pain when they chew, or any vision changes, this is a red alert. It's caused by inflamed arteries that supply blood to the eye, and treatment with high-dose steroids has to start immediately to prevent the catastrophic outcome of permanent blindness. You don't wait on this one. Okay, after all that serious stuff, how about a piece of truly fascinating medical detective work? What if I told you that a doctor could diagnose a very specific, rare type of headache just by giving you one kind of pill? Sounds like something out of a movie, right? Well, it's totally real. It's called the indomethacin response. There are a couple of rare, strictly one-sided headaches that have this unique quirk. They are completely knocked out by a powerful anti-inflammatory drug called indomethacin. If the headache totally vanishes with the drug, then boom, you have your diagnosis. It's one of those amazing cases where the test is also the treatment, a true medical magic bullet. So, we have covered a ton of ground. Let's bring it all together and focus on the single most important takeaway: how to figure out what your headache is telling you, and, most importantly, when you absolutely have to stop guessing and see a doctor. So please pay very close attention to this. These are the red flags. If you have any of these symptoms, you need to get medical help right away. The worst headache of your life can be a sign of something very serious. A brand new, severe headache if you're over 55 requires an urgent workup. And any headache that comes with vision loss, fever, a stiff neck, or happens after a head injury, these are not things to ever ignore. So at the end of the day, a headache is so much more than just a pain. It's a complex signal. It's your body trying to give you information. So the question is, now that you know how to spot the imposters, the common players, and the serious villains, are you ready to actually listen to what it's trying to tell you?